We'll continue on with just kind of discussing some general treatment principles when you're addressing these patients, why some of these general treatment principles are discussed, and then hopefully give you some different options. I also have later on some herbs and some food therapy that you can use in conjunction with some of these patients, because as I talked about yesterday, with acupuncture you can get things moving in the system. You help with stagnation patterns. You help with the delivery of nutrients to the periphery and to the tissues. You can optimize organ function, but you can't put anything into the body. If you're putting anything in, it's generally your own chi, and then that's not good, because then you become exhausted and you become depleted as a healer. So oftentimes herbs and food can be very helpful, and the herbs and the herbal recommendations that are listed, they're very safe. I've added a couple of other ones that when I was looking through some things today that I thought might also be beneficial. So we'll talk about those as well at the end. So with generalized wave patterns, just kind of generally speaking, you need to identify the pattern in the organ or organs that are involved, because sometimes there's more than one, especially if it's a chronic patient. And as we talked about, as one organ system fails, that's the one thing in Chinese medicine. Everybody has to play together, and they do play together. So as one organ system starts to have difficulty, the other organ systems will also try to rescue, or they also become affected. So you need to identify those, nourish those organ systems best you can. If heat is present, eliminating the heat, these are some of the, I think probably some of the better points to use in veterinary practice that will help to eliminate heat as far as yin spring points. With deficiency heat presentations, governing vessel 14, obviously you can also use to eliminate heat, as general or air jian or even wei jian can be used to eliminate heat if you've got a full-on heat excess pattern. With deficiency heat, you need to be careful with that and clearing the heat. What's paramount is you can use some points to clear the heat, but you really need to nourish the yin at the same time. So using points like kidney 2, kidney 10, both of these points not only clear heat from the kidney, but they nourish the yin. Kidney 6 obviously nourishes the yin. Liver 8 will help to nourish the blood. Lung 5 also helps to nourish lung yin and kind of nourishes the fluids of the lung. The other point that I would think about, besides spleen 6, which is kind of obvious, but also CV12. CV12 being the moo point for the stomach, and the stomach being the source of all fluids, is another point that you could think about in these treatment strategies. If it is secondary to B syndrome, then obviously moving qi and blood along the channels. Use your shoestring points to invite the pathogenic factor to exit the body, to not progress deeper into the interior. Using your Jingwell points as well to help invite the external pathogenic factor to leave, and using your He points to tonify and nourish those organs. I think this is one of the reasons maybe stomach 36 was so commonly used in TCM, is because it does, it's the He point for the stomach, spleen. As you nourish these two organs, you're going to be nourishing all organs. But also keep in mind your other He points, like lung 5, like spleen 9, bladder 40 even can actually, when used properly, can actually be something that will help to nourish and give some more strength to the kidneys themselves. So those are things that you want to think about with generalized treatment principles, addressing those underlying deficiencies. Now, in the Neijing Suwen, it talks about going to the Yang Ming. So it talks about, Chibo talks about using the Yin spring points and the shoestring points to encourage and to release the heat, but also to rectify the improper movement. And then he also states to go to the Yang Ming. It is said to be the sea of nourishment. It is said to be the sea of the 5 yin and the 6 yang organs. At the time of the Neijing Suwen, a lot of times the heart channel was not kind of considered accessible. So oftentimes it was called the 5 yin and the 6 yang. The Yang Ming was said to irrigate the original sinews which run to the pubic bone and up the spine in the back. Okay. So what is the meaning behind that? What is the original sinew? Actually, this is referring to the Chong Mai. Okay, so when the points that are listed here, you see the large intestine points for the forelimbs, stomach points for the hind limb. These are points that we already talked about. But one of the points that you also see down here is stomach 30. Okay, stomach 30 is a crossing point with the Chong Mai. Now, according to Machocha, the Dai Mai and the Du Mai also cross here, but I cannot find any other references for that, and I have quite a few. So I'm not really sure where he's getting that from, because I can't find the reference that he's talking about. But so when I was thinking about this, I can see kind of a way that these can be related. The Chong Mai does give rise to the Du and the Ren. Okay, the Chong Mai is it's the first extraordinary vessel that actually forms in the body. Out of the Chong comes the Ren and the Du. And the Chong Mai, where it becomes exteriorized in the body, is at stomach 30. So stomach 30 is definitely an intersecting point with the Chong. The Chong Mai, its major trajectory that we utilize exteriorly is it shares points with the kidney channel. So as the kidney channel percolates up through the lower jiao, middle jiao, and up along the chest, those kidney points are utilized to access or to reinforce a Chong Mai treatment strategy. So stomach 30 is an intersecting point, and the Chong giving rise to the Du and the Ren, and the Chong has an internal channel that actually goes up the spine. So it supports the Du. So I can't really say that the Du intersects with stomach 30, but the Chong Mai does, and the Chong Mai does support the Du Mai, similar to how the Ren Mai also has an internal channel that supports the spine. So that's not too difficult. The Dai Mai intersecting with stomach 30, yeah, the only way that I can envision in that is that the Dai Mai originally was, it's called the belt channel, and its original trajectory was just a belt right around the middle, kind of like right over the umbilicus. That trajectory is kind of changed where it dips a little bit down to not just going around the umbilical region, but it goes down to gallbladder 27, gallbladder 28, so it goes lower on the pelvic bones. And then in treatment strategies, because the Dai Mai philosophically and physically, it is about holding things for a while and then being able to let go. Well, one of the things that we tend to hold on to is dampness. So the Dai Mai is about holding, sometimes it will accumulate dampness, and then we can employ the Dai Mai to release that dampness, especially from the lower jiao region. And in doing so, points like CV2 and CV3 are utilized to invite, again, that pathogenic dampness to vacate the body. Okay, CV3, we all know, is also the mu point for the bladder, and the bladder, as we talked about yesterday, is one of the areas that is a normal way for us to get rid of dampness. So now CV2 and CV3, yeah, they're at that pubic bone, and stomach 30 is it's in that inguinal region, just lateral to the femoral artery. So, or I'm sorry, medial to the femoral artery. So that may be a little bit of a jump, but I could see where that. Yeah, maybe there's a tie in there. The Dai Mai is also important for holding the integrity of all the channels. So that may be the connection between the Yang Ming channel and the Dai Mai. One of the things that's also stated, getting back to, so that kind of gives you maybe that explanation for stomach 30 and the relationship of the Yang Ming to being important in nourishing the body. One of the things that's also stated is that when the Yang Ming is deficient, the original sinews are weakened. And this actually refers to the Chong, which again is sometimes called the penetrating or the thrusting vessel. And in some writings, you will see where the Chong Mai is also associated with the Zong gene that we talked about yesterday, the reproductive ligament, which is going to be the penis, and that is that is considered sometimes in some writings one of the ancestral ligaments or the original ligaments. And so what it is said is that the Chongmai is deficient, then the original sinews will be weakened, referring to the Chong, which again is the mother of all, because that is the first extraordinary vessel that is laid down. It goes on to state that if the original ligament is weakened, the daimai doesn't fasten and atrophy syndrome results. So again, it's this connection between the Chong and the daimai on an extraordinary vessel level, where the daimai doesn't fasten, and the daimai, as we'll talk about, because I do have a slide later on the daimai, it's considered the belt channel, and the belt needs to have good integrity. If it's too tight, it doesn't function well, but if it is too loose, it also cannot function well. And because it provides that three-dimensional integrity, that three-dimensional space for all of the other channels in the body, if the daimai is flaccid, then nothing else is circulating either. So this is what's meant by it's not being able to attach properly. So again, there is a connection between the Yang Ming, the Chong, as that has a very important connection at stomach 30, which is called Qi Chong. I mean, it's a Qi thoroughfare. And then again, with that relationship at the extraordinary vessel level, at the Jing level, at the level of essence, with the Chong and the daimai. And sometimes the daimai, I have used the daimai in some of these patients that have weight atrophy syndromes, especially the degenerative myelopathy patients, and we'll talk about that in just a little bit. But this is one of the reasons why the Neijing Suwen stressed to go to the Yang Ming. Not that it's just all about stomach 36. It's actually really more about stomach 30, okay? Now, another technique that you can use is and I have to thank Bruce Ferguson for this, because I did not read this. I did not find this. This was Bruce's thing. You got some book, The Golden Needle Wang Le-Ting or something, the 20th Century Master's Approach to Acupuncture. And according to this author, what you must do first is select the Dumai. And there is indication for this. In the classics, the Dumai was indicated for paralysis and wilting, it was indicated for hemiplegia, and it was indicated for wind, cold, damp, B. In fact, the Dumai was actually wind as a pathogenic factor and how it invaded. The Dumai was the example given for wind's invasion, and actually wind creating paralysis and wilting, wind creating the hemiplegia, the wind stroke patterns that we see, and wind, of course, invading and causing wind, cold, damp, B. It was also through the Dumai where wind pathology could be transferred to the other side of the body, and it was actually in the discussion about the divergent channels, where you take a pathology and you divert it via the divergent channels to your weaker side. So you can continue to use your strong side, but all of your pathology ends up coming up on another side. So, and that was all about the do. So there is, in a number of areas, there is precedent for this, going to the Dumai. And basically it's very simple, is you just insert needles into deficient points approximately every other vertebra from governing vessel 14 to Yao Bai Wei, which is Bai Wei at the lumbosacral joint. It's very simple to do. I have employed this, and it works very nicely. It's very easy to employ. It's very nice to employ. I tend to palpate for the deficient points. Some people will just put in needles every other vertebra. Either way works, and it is a very nice technique to use and very simple technique to use. You don't want to use Moxa with this technique, because if you use Moxa, then it's too strong of a stimulation. Moxa we often think of it as only warming, but actually Moxa is a very strong mover. So you would also not do electroacupuncture with this technique, because then the technique is going to be too strong. Okay, but it's a very simple technique. In the following slide, what I put there was the different points that are along the governing vessel channel and their names, and actually we don't talk about all these points. The only ones that we really talk about is governing vessel 20 and governing vessel 14. We pay lip service to governing vessel 12, which is actually an incredible point to use. I find myself using it a lot. And then we talk about governing vessel 4, 3, and 1. But actually some of these other points will help with some of your patients as well. So now understanding their names and understanding the individual indications for these points or their functions, maybe this also gives you something to think about in some of these patients that have a Wang atrophy syndrome, or even these patients that have intervertebral disc disease and are very paretic. I have used it in these patients as well. This is Rocky. Rocky this is a photo of him in January of 2001. This was shortly before he came to see me. Rocky, for Christmas, decided to have a ruptured intervertebral disc in the lumbar region, so he was taken to surgery right away. And I saw him in March, I believe, because 3 months post-surgery, Rocky still could not use his hind limbs. So he'd had emergency surgery to remove the disc material. He had deep pain at the time prior to surgery and immediately post-op, but for 3 months post-op he couldn't walk. So actually this picture that you see of him, this isn't at our practice, but we kind of had the same color scheme. It was also built in the 70s. This was actually his regular veterinarian's practice. His owner was kind of a tiny lady, and Rocky was a big shepherd. And so she had a full-time job, so she would actually take Rocky to the practice on Monday mornings. They would take care of him all week long, and then she would pick him up on Friday evenings. And she would take care of him over the weekend, and then she would bring him back on Monday morning, because Rocky was urinary and fecal incontinent, and a big guy, and he couldn't walk. So a lot of intensive care, and she did this for 3 months, okay? So when I first saw him, he did have pain perception, but he had decreased conscious proprioception in the hind limbs, obviously. Oops, my thing isn't working. Oh, shoot. Okay, so this would be considered a Qi deficiency distal to the site of the incident. He had advanced atrophy in all of the hind limbs, hind limb muscles, so this is going to be your Wang atrophy, right? Had no urinary control, limited fecal control. His forelimbs were fine, and the rest of his physical exam was within normal limits. Now this is back in 2001. I wasn't doing a lot of acupuncture at that time, but I was doing quite a bit, so I probably didn't palpate as many of the points that I would have palpated now, but everything was pretty much in good shape. He didn't have any urinary or fecal control, so this is going to be what organ system is going to be affecting or is going to be governing the lower orifices. This would be the kidney. So this would be a kidney Qi and a kidney, maybe even a kidney Yang deficiency, but at the very minimum we can say a kidney Qi deficiency. Forelimbs are fine, rest the physical exam is within normal limit. His back chute points, he was painful from bladder 17 to bladder 23, which that can't tell you anything. All that tells you is that he had a load of stagnation. So lots of stagnation in the body and a lot of pain. So his tongue was reddish purple with a white coat and very dry. So that reddish purple color, that also gives you an indication that there's a lot of stagnation going on that's in the body. It's white coating that was dry, so he's got some fluids that have come up. He's had maybe some dampness that's there, but with that consistent stagnation, things not moving, it starts to get dry because fluids are not even able to move properly. He's got so much stagnation in the body that you're not really even getting a lot of proper fluid movement in the body. Pulse very wide, which if you have a wide pulse, that's going to give you a sign of deficiency. But also very turgid, which is kind of my explanation for a pulse of stagnation. What I mean by turgid is if you have a garden hose and you turn on the water full blast and you feel that water going through the hose, and then all of a sudden you crimp it, and what does the water feel like? Now you have that turgid, that's what I mean by a turgid pulse. So it's kind of a full pulse, but it's, you know, things are trying to move, but they're blocked. So again, it's a pulse consistent with stagnation. So he's got a lot of signs of stagnation, but he also has signs of deficiency. We have a qi deficiency because of the atrophy in the muscles of the hind limb. We have qi deficiency because of decreased proprioception in the hind limbs, qi deficiency because of the wide pulse, but we've got stagnation with the incredible pain in the back shoe points and that reddish purple tongue as well as that full pulse. So Chinese medicine diagnosis for him was Wei atrophy secondary to B obstruction and a kidney qi deficiency. So treatment principle for him was to move the qi and blood along the channels. So you have to find your channels. Basically, that's going to be your bladder and governing vessel channels. Nourish the kidney, which is the mother of the bone, but also the governor of the lumbar area and the stifles, and the governor of the lower orifices. And then we want to relieve the qi stagnation. So I did dry needles and electroacupuncture. I just did electroacupuncture spanning the lesion. He had his hair back, and I didn't really have any notes from the surgeon because I wasn't the primary veterinarian, so I just kind of made a guess. And I used a dense dispersed setting between high and low, and I had my little Chinese thing, so I don't know really the currents that I was using, but it just went, you know, kind of slow, and then it went faster. That was your dense dispersed setting. And I saw him once a week for 4 treatments, and then every 2 weeks. So the points that I used bladder 17, which is a good point to basically invigorate the blood, and by doing so it's invigorating the movement of blood throughout. It's also a very good local point for their trapezius muscles, and I think any of these patients, I mean, here it's been 3 months and he's been trying to get himself up and moving around and he just can't. So it's also a good local point for the trapezius. Bladder 17, I use bladder 18 and bladder 23 for the liver, the kidney, back shoe points. Bladder 40, master point for the lower back, helps to free the channels. Bladder 16, kidney 3, freeing the bladder channel and also nourishing the kidney 3 being the source point. I use small intestine 3, not actually as a do-my strategy, but just because as the do-my or as small intestine 3 opens the do-my, it kind of also has that ability to help with qi stagnation and blood stagnation throughout the body. So I didn't use it specifically as a do-my strategy, but more for it freeing the channels and freeing obstruction in the channels in general. I used gallbladder 34 to strengthen the tendons and ligaments, and I used spleen 6, San Yin Jiao, to try and help nourish the yin, and spleen 6 also helps with blood stagnation, primarily in the lower part of the body. I used the Yang Jingwell points on his hind feet, so, you know, stomach 45, gallbladder 44, bladder 67. I stimulated all of those points with pretty aggressively, and when I needle those points, I actually, I really jam the needles down to the bone. I really tried to stimulate that peripheral nerve system and kind of piss it off a little bit so that you get a very strong stimulation. And then I used electroacupuncture on the point spanning the scar, which I think was from bladder 21 to bladder 26 are the points that I used. So after 4 weekly treatments, he was able to try and scratch his ears. And actually after the first treatment, he had regained urinary control. After the first treatment, he regained fecal control. After the second treatment, he regained urinary continence, so that was great. And after 2 months, he was able to walk, swim, and virtually had a normal life. Now, after 4 weekly treatments, this was Rocky. Okay, so he's trying to scratch his ears, and you can see the dates on this. This is in May of 2001, so this is a couple months after I'd been working with him. You can see that he's a big guy, and he had pretty good muscle development that came back, right? And this was his favorite thing to do, was to swim. And the reason I talk about Rocky is because this is before I was doing any herbs, so I do have some herbal, you know, there's a chart about herbs and foods. So for those of you who don't do a lot of herbs, or you haven't used any herbs and you're frustrated about, you think, oh, I could never do something like that. I didn't use any herbs for Rocky, and as far as I know, he was getting fed Purina dog chow because I didn't know anything about food therapy at this time. This was 14 years ago, okay, a long time ago. So when you see a patient like this, don't hesitate to try, because, and this is even one of the things that Machocha says, and one of the things that's stated in the classics, is that acupuncture is, you can be very effective with your acupuncturists for Wei syndromes because you're moving qi and blood in the channels, and that's what you need to do. Okay, so the nourishment is important, but also the movement is important.